Real videos, real patients, real chiro. Ah, there's a new slogan. All right. Like I can get my whole, hi guys, like I can get my whole hand through her low
and
back.
that's just
there.
me lying. No.
That's just your normal.
Yeah,
right?
very naturally, like back.
Back.
I have a pelvic tilt.
Yes, you do. Yeah, that's what that is. What's happening when we get that kind of almost like the bum that sticks out a little bit. Some people joke they call it the TikTok girl bum. I had a professor who anecdotally referred to this region as the safe. You know why?
Tell me.
Because it's always locked up.
Stop.
Stop telling me. Kat.
Yes.
Good to meet you today.
Thank you
Thanks
so
for
much
coming
for
in. Kat is a friend of actually my social media manager and a theater, is fanatic too strong a word?
Sure, I don't think so.
Theater fanatic. Went to go see her in one of her plays, and it was very fun for the whole family, I must say. But she's in today with a couple of complaints. I'm going to let her kind of walk us through them if she's comfortable doing that.
Yeah,
so,
absolutely.
Kat, yeah.
So I've been having lower back, I guess, issues or struggles since I was probably 11 or 12.
Okay.
So that's about 10 years now.
Long time.
A long time, yeah. I struggle the most with my hips and my hip sockets. I have very tight hips, and I'm in massage therapy to kind of help remedy some of that. However...
Sorry, you said you're in massage therapy. Like you're seeing a massage therapist, or you are becoming a massage therapist?
Oh, no, I'm seeing one.
Oh, okay.
Like,
I thought... Massage therapists are really hard to meet, so for a second I got so excited, pumped up.
No,
it's like, oh my god,
yes,
okay.
no, I'm in massage therapy sessions.
There, okay.
And I know, disappointing. But I see them probably twice a month, and that helps kind of keep the muscles under control. But the bones, on the other hand, I feel like we're in a mismatchy kind of spot there.
Okay, so you've had these this kind of both sides hip issue?
I would say yes.
So this bilateral hip issue for the past decade, essentially, what has it kind of, is it getting in the way of anything you're trying to do?
I would say yes.
Such as what?
Heavy lifting is pretty much out of the question.
Okay.
I have a lot of, like, I would say like the lower lumbar support is very
wonky,
weak,
okay,
if anything. Like bending down too far, I do feel pain
in your low back. Okay,
and that's pretty much just something I've become used to. I would say that it's consistently at a 6.5 or a 7, like always.
Just like not even with just bending down, but just in general.
Like right now, even if I'm going like this, I can feel it. Like if I arch my back a little bit, I can feel it.
That's that extension movement, moving back like this, huh?
Yeah.
Okay.
And it's the same forwards if I go farther, but it's worse backwards.
Okay, interesting. It's not too often we see somebody who gets discomfort both in flexion and extension, but if you've been dealing with this for a decade now and you've just kind of learned to adapt to it, that's not really a great thing to just live with, at least not in my opinion. What else, aside from just the massage therapy? I know we talked briefly off camera that you had seen some other chiropractors and whatnot, but what other interventions have you tried for this, which clearly weren't the most successful, but what else have you tried for this?
Lots of stretching.
Okay.
And kind of like, I guess, intentional movement.
Okay.
So kind of doing like those frog stretches, whether that's like butterfly legs forward or frog backwards, just kind of trying to open the hip flexors a little bit.
Yeah.
But I can only do so much,
of course.
I guess.
Yeah,
Yeah, mostly stretching.
But mostly you've been trying to do that stretching component. Okay. And when you are stretching in the moment, do you find that relieving in the low back at all, or not particularly at this point?
Over time, yes. Not necessarily instantly. Like I don't have like a spark moment where I'm
it's
like,
it feels
there's
so much
no
better.
relief.
No. Okay.
Like that release does not necessarily always happen.
Okay. You also mentioned that you were getting some upper back, or you called it shoulder location discomfort as well. Can you share about that at all?
Yeah, so I mean, for my job, I stand all day.
What do you do?
I work in a front of house of a restaurant, so
okay, you're going to be
serving,
you're going to be standing all day.
Standing all day, and when I'm looking at my POS screen, my screen, it's down, so a lot of like phone hunching, but it's just I don't have a way to work around that. It's not like I can use my phone less.
Job,
it's just the nature
right?
of the
like
job,
those are some of the more frustrating complaints, when you can immediately relate your physical issue to something you do for a paycheck, because obviously you need your paycheck. You can't stop that. Where are you getting that exactly in your back?
Like kind of like
Oh, thanks for
Middle
turning
of
towards the
shoulder-
camera. That's awesome.
Middle
Yeah.
of the shoulder blades kind of like
Up into
lower
the base of the neck
base of the
too.
neck.
Does that kind of result in any headaches as well?
Yes,
Yeah.
absolutely.
Okay.
I
So.
have chronic migraines.
Oh, we love
and,
that. Yeah, we don't love that. We hate that, but we love that.
We love that.
Yeah.
That's
Okay.
information that we can
Yeah,
use
that's
to move
good.
forward.
Absolutely.
But
She gets
yes,
it.
a lot
Kat
of
gets it.
tension in the headaches.
How
Sometimes
frequently do you get headaches
I would
versus
say
migraines?
headaches almost daily.
I'm sure this weather doesn't really help.
No,
It's
not
raining
at all.
out. Yeah,
And it
okay.
never makes its mind up what it wants to stay at
Oh,
either.
okay, great. Yeah.
So migraines can come into mostly my left eye, but also my right eye.
Okay,
and
so it
that's-
switches.
It does,
Okay.
and it affects driving. It affects work. If I can't see out
Migraines
one eye, I'm not
affect
going
everything.
anywhere. Exactly.
Yeah,
So,
okay.
and I do know that that's related to like my jaw tension as well as
Okay, so
whatever's
jaw
going
issues.
on.
Yeah. Okay.
And I used to see a speech language pathologist, and they would do like tongue massage and
Tongue
jaw
massage, okay.
and like cheek massage for me because
How long ago was that?
I want to say probably like 4 years, 5
4
years.
years. Oh, so like relatively recently,
Ish,
not like
so,
that far away. Okay. I'm curious about you because you mentioned jaw tension specifically. I don't know if you know this, but I actually treat quite a lot of jaws. I saw one earlier today.
I didn't know that.
Do you get jaw pain regularly?
No, I don't.
Okay, you don't get jaw pain. But what exactly was it that they were treating then with you? Like you just very rare will somebody go like, oh, my jaw's tight without any kind of pain being the indicator.
I'm a
there.
singer by
Yeah.
profession,
Okay,
so-
right. You would be more aware of this than the average person.
Yes. So
Okay.
I was seeing an ENT as well as an SLP at the same time. And I had like the cameras up the nose, down the throat.
Wow,
It was not
okay,
pleasant
yeah.
at all. I had nodules for a while, so I had to work with that.
Yeah.
That was when I was like 13 or 14. So
Okay.
I've been doing this for a long time. Unfortunately.
Mm-hmm.
But yeah, the kind of thought process behind that was to like see if that would open up any of the vocal passages to have looser muscles in my mouth.
Interesting.
And then we
Okay.
kind of found that helped to relieve the headaches by
Okay.
just by nature of
Just
what
so
it was.
were they doing like intraoral massage with you then, like inside the mouth massage?
Yes.
Yeah. Okay. You said tongue. Yeah, that would
Yeah,
make a lot of sense.
tongue, cheek, and it hurts.
Okay. Yeah. No, it does. We have lots of sensitive muscles inside the mouth, guys. Okay. Now, you obviously haven't been having that worked on still to date. Now, how long have you had the migraines for throughout your life?
7 years.
So, like before you started doing the intraoral stuff,
Yes.
did you notice that the migraines went down in frequency or intensity or in any way kind of improved while you were getting the internal work
Yes,
done? Okay.
and that's kind of how we figured out that there was something
Yeah.
that was kind of connected there.
All right. If that's something you're interested in, we can take a look at what we can do inside the mouth. Absolutely. If we can help your migraines that way, I say we should probably do it. Okay, so we've got a low back / hip, upper back, neck headache, as well as potential jaw complaints. We'll do a physical exam for all of those areas and figure out what ways we can help you out the most, okay?
Perfect.
All right, so Kat is getting issues up in the neck, upper back, as well as the low back. So we're going to start with a pretty basic range of motion exam as we usually do. So Kat, just get started. I'm going to get you to bring your chin down to your chest for me. Does that provoke any of that POS stiffness that you were talking about earlier?
Not at the moment.
Not at the moment. Okay, now if I do something kind of mean and push the head further, how about now?
No.
No? Awesome. You should look up towards the ceiling for me instead, please. How is that instead in this region?
That's okay.
That's okay. Again, I'm going to pull you a little further. That's okay?
Tension in my head. Where the
Tension.
migraines go.
Okay, let's go ahead, go forward. All right, I'm going to get you to rotate your head as far as you can to the right. That's okay, we can get to a full 90 there. That's good. Now as far as you can to the left. We can't get quite as far. We can get to about 80. Okay, face forward, tilt the right ear to the right shoulder. Good, we can get to about 50, left ear to left shoulder. Get to about 50 as well. Okay. So it's interesting to see that just in tilting the head backward, we start to get mild aggravation of that the migraine symptomatology she was talking about. That tells us there's definitely a cervicogenic, that's the really fancy way of saying related to the neck, component to what she's dealing with. Okay, if we move the neck and that causes complaints, it's pretty easy to establish a relationship there. Not necessarily causative, but definitely associative. Okay, next up I'll get you to give yourself a nice tight hug for me. You've probably earned it. I'm going to get you to rotate. Nice nails, by the way. Those are nice. I'll get you to rotate as far as you can to the left. Good. Okay, so you are quite flexible. We can get up to about 70 degrees there. Now as far as you can to the right, please. We can get to 70 degrees again. Very good. All right, you can relax those. Now I'll get you to stand up for me. And here we're going to check out that lumbar range of motion. Please bend down, try to touch your toes for me. Does that provoke the low back complaint that you were telling me about beforehand?
Here, yes.
Here, both sides. Okay.
Yes.
So she's running her fingers right along the SI joints. We're very familiar with those at this point. You can come back up for me now. Now we're going to extend back the other way for me.
Now I'm feeling the pain already before I even go
Even worse going back further, right? Okay.
So, there, I mean, I can go back farther.
Yeah, you are bendy, that's for certain.
I've already felt the pain there.
All right, I'll get you to have a seat next, okay? So what we're doing here is, Kat just mentioned she had her legs up like so, and then when asked to straighten them out, and we're a little bit off center here, so I'll just fix that, but then when asked to straighten them out, she, oops, wrong way, immediately got more pain in her, where exactly?
Like right here in my lower back.
Right
the
here in
same
the lower
area.
back. Okay. And coming down here, she's got a very large, like I can get my whole, hi guys, like I can get my whole hand through her low
And
back.
that's just
there.
me lying there.
So that's not you arcing.
No.
That's just your normal.
Yes.
Eh?
That's how I stand. Like my hips are just very naturally like back.
Back.
I have
okay.
a pelvic tilt.
Yes, you do. Yeah, that's what that is. I haven't even done a postural exam. I'll do that. Well, maybe actually we'll do a postural exam on camera for the first time if it's as positive as I think it's going to be. But having your pelvis tilted, a lot of this is a bit of a hot topic, but having chronic anterior or posterior, less common, pelvic tilt can absolutely result in asymmetries of tightness of the anterior or the quadriceps and the posterior or the hamstring chains. That can cause back pain if it keeps on going on for years and years and years and years, right? So we're going to get into the orthopedic and palpation exam of the lower limb. Let's start obviously with the classic straight leg raise. I'm going to bring this straight up. Does this provoke any discomfort in the low back? You can probably get this up to 90 is my guess. You as a dancer type person. Yep, that's okay. Slowly lower it down yourself as far as it'll go, please. That's all fine. We'll do the same on this side. I can't believe I can get my whole hand through there. That was actually that's
yeah,
a
there
real.
we go. This one's not as far.
So this one's not as far,
No.
but it's not provoking any discomfort either. So you can get to 90 on both sides, which means you're within normal limits. It's not something to be concerned about overly, okay? So next up, we're going to bend this knee. I'm going to place my hand behind your hip here. I'm going to press right through. Does that provoke anything for you?
Yeah.
Yeah, we're kind of right where my fingers are there. Okay. So again, that's a positive thigh thrust test. It tests for the SI joints. Bring this up, which coincidentally we're right where she was pointing when she was doing her forward and backward bending. Again, hand behind here, push on through. Same concept. Worse on this side. Okay, a lot worse on the left side. All right. Let's do a hip range of motion exam. I'm going to go ahead. This can come on up. That's okay. This might pop here if it's as sensitive as you say it is. Nope, but that's okay. Is that okay? All right. You can get to about just north of 45 degrees on the internal rotation. Good, and let's do that on this side. That's okay. Just north of 45. Oh, and yep, external rotation. That's okay as well. Good. Okay. Now, tension in the hip flexors. That's tender right there, isn't it? We're going to compare that to this side over here. Which side? Still left is worse. Okay, syncs up with the SI there. Having extraordinary, first off, we have two primary hip flexors. Okay, we have the rectus femoris, which connects from the bony ASIS right here. I'm going to show her on this side so you guys can see, down into the quadriceps tendon, into the tibial tuberosity, ultimately as the patellar tendon, as well as a muscle called the psoas. The psoas muscle connects from the lumbar spine proper down into kind of the groin region of the hip there. So you're definitely tight in the quadriceps. We can tell that because when I poke it, her face screams ow. But we're also going to look up to check this psoas muscle itself. Has anybody told you about the psoas muscle before? Is this the first time you've heard about it? Okay. So to get at the psoas, try not to kick me. I'm going to get you to just turn your face to look at the camera.
I think I know where it is.
Okay, perfect. Yeah. I'm going to find that bony ASIS, as we were talking about right there. I'm going to get you to take a big breath in for me, all the way out. All the way out. And one more time in, and all the way out. And I want you to slowly lift this leg up just 5 inches for me. That's provocative, isn't it? Okay, yeah. Don't know what provocative means, but it gets the people going. Okay, you can lower that down. Good, good. Okay. So we've got a tender psoas and tender rec fem. Those are our two primary hip flexor muscles. I'm going to guess it's also tight on this side. I'm not going to do it on camera because that would involve me being in the way of the shoot. But having super tight hip flexors will tilt the pelvis, or can potentially tilt the pelvis, anteriorly, which coincidentally leads to long-standing chronic stiffness of the low back. I probably shouldn't turn away from the mic when I'm talking. Yeah. So let's get to the next part of this example. So I don't do postural analysis very much on this channel because usually it's actually unremarkable, but in this case, I wanted to make the exception. So, Kat, I want you to just kind of like shake around for a second and stand as you normally would. Boom, from there. Good. All right. So one thing that I'm noticing about Kat right away, and you guys might be able to pick up on this too, is that we have that very excessive lumbar curve present here. And that was also present when she was laying on her back too. Again, I could get my whole hand underneath that without much of an issue. But what's happening when we get that excessive let me kind of show you guys this lumbar curve like that, is our pelvis is literally being tilted forward, anterior pelvic tilt, which is what's happening when we get that kind of almost like the bum that sticks out a little bit. Some people joke they call it the TikTok girl bum, right? They'll stick their butts out. But that's a sign that we are getting hypertonicity of the anterior chain or hypertonicity of the QLs and the multifidus back here. Coincidentally, we are getting comparatively weaker, I hate using that word because I'm very doubtful that you're weak, but comparatively weaker obliques, front abdominals, glutes, and hamstrings. Okay, so the solution to that is to ultimately loosen up the QLs and multifidus and the hip flexors while strengthening the posterior chain as well as the abdominals. And that's probably going to be what most of the rehab plan is for Kat. She was more tender on the left side SI as compared to the right. We're still obviously going to feel through both to see if that was just perhaps the way that she was laying. But as a brief anatomical reminder, spine, most people get that one right. Sacrum is the base of the spine. The sacrum connects into the iliums, which are the hip bones proper out here. So the sacroiliac joint on the side, I'm going to press on through. That okay? Mm-hmm. That's okay. Good. Pressing this side, that's okay too. Okay, so we got some discomfort on the right. How's the left one more? Okay, there it is. All right, needed a little bit more pressure is all. Now feeling through the lumbar paraspinals, para meaning next to, and spinals meaning obviously the muscles. It's not as tight as the anterior, as the hip flexors were. There's definitely present tension though, especially, yeah, as I go out further, more into the meat of the muscles itself, yeah, tender, yeah? Mm-hmm. Okay. And you feel most of your tension kind of up through in this region, eh? Mm-hmm. Okay. I had a professor who anecdotally referred to this region as the safe. You know why?
Tell me.
Because it's always locked up.
Stop.
Stop telling me right now. You're done. You're cut off. Okay. Now, once again, with that anterior pelvic tilt, if the front of the legs are really tight, that means that comparatively, the posterior elements, meaning the glutes as well as the hamstrings, aren't pulling as efficiently or back to counteract that movement. So are you okay if I feel through the hamstrings and the glutes today as well there, Kat? Perfect. Okay. So starting with the hammies. Are you kind of tender as I poke through still?
Yeah.
Okay. And then primarily two glute structures that I want to check. The first being the glute med, which is out here.
Ow.
That's tender there. Okay. Poking through. Piriformis is next up. The thumb there. Is that okay?
Yep.
All right. So fun fact about when people describe tightness or tenderness of a muscle, that can be due to either the muscle being super contracted itself, because if a muscle is super contracted, it makes sense that it's tight, or it can be due to a muscle being overly stretched consistently, in which case it would feel almost like a guitar string, still quite uncomfortable to poke. So her being in pain, or her having sensitivity while I do this, isn't exactly shocking, but what I'm trying to feel is compare the tone of the muscle itself to what's on the front, in which case it is kind of it is syncing up to what I would expect it to be. I'm going to feel the other side real quick. With it being less engaged. Now actually there's an exception right there. That piriformis is quite on fire, but that's okay. I can feel you find me. Is that tender for you, or are you okay?
A little bit.
A little bit? Okay. Okay. And hamstrings are
very
okay.
tight.
They're tight
I mean,
for
they're
you.
tight.
No, they're tight for you. But for me,
Okay,
they feel comparatively soft as compared to the firmness of the anterior chain. That's what I'm trying to drive
Good
home
stuff.
here. Doing a poor example of explaining this properly, but we'll make it. Okay, there's glutes, tender too. Okay, let's go back up to the upper back here. So you've seen a chiropractor before, right? They more than likely adjusted or quote unquote cracked you, yes? Okay.
I'm
So
a big cracker.
oh yes, you were telling me about this. So so that you understand kind of my perspective. The first time you adjust somebody, there's actually no way to really know how much force is needed for them to go. I could basically sneeze on some of my 300-pound patients, but I need to body slam some of the gymnasts that I treat, for example. Obviously, I'm not going to start off with body slamming you. That's a little bit negligent. I'm going to start lighter, okay? And if you don't release with that light pressure, I'm going to gradually add a little bit more, a little bit more, a little bit more, okay? I wonder if you had self-adjusted yourself before you came in today.
Maybe by accident.
That's okay. We'll give it a try, and if nothing goes, nothing goes. That's fine. I don't edit in fake cracks. So breath in for me, and all the way out, all the way out. Good. Okay, that was a really good one. Still breathing? Oh, okay, yes, she is still breathing. Good. Okay. And all the way out. Good. There we go. This one from this angle. Yes, I can. Breath in. Oh, okay, she's going. There we go. There might be a few more lower down, so let's just try down here. Breath in. All the way out. Yep. Good job. Okay, let's stretch out the low back. Tender there, huh?
It hurts so much.
You're okay. If it is too much, you let me know and I will back off.
Oh, I will.
Good. I figured you wouldn't be afraid to speak your mind.
I'm also just a chronic complainer, so.
It's okay. I'm a delicate flower. When I'm on the table, I make so much noise. You okay with that one? Breathe, breathe. I am seriously the worst patient. Yeah, okay. Okay, let's bring this leg up. I'm gonna get you to scooch your hips towards the edge over here. Yeah, come close, good, and then relax for me. Awesome. I'm gonna take this, I'm gonna pull, nice, hold right there, good. All right. So sometimes the flexible patients are the hardest ones to get, but let's see. Breath in, all the way out. Relax the upper body for me. There we go. That went perfectly. Let's get you on the other side. Already well positioned. That's good. Okay, breath in, all the way out. Good. There was a little one on the first go there. Let's get you next up. Probably yes on your back. What colors do they change?
Blue and green.
Look up again? No, not like just relax that, just the eyes. Damn! Okay. The whole like restaurant thing doesn't work out. Is there such thing as like an eye model? Is that a thing? Yeah, that should work. Alright. So one question for you is if at any point of me poking around so obnoxiously back here, does that aggravate
Ow.
any? Okay,
Yep.
yeah, well
Right
that
there.
aggravates there, but like does that trigger any of the headache
Yes.
complaint? Yes,
Yeah.
okay, gotcha. Alright. Worse as I get lower down or higher up?
Higher up.
Higher up, that makes sense. Okay.
Yeah, there.
Okay, that's really the spot. So
Yeah.
that's the right side. Maybe about a C3, C4 for you nerds at home watching. Alright, left to left.
There.
That's there. Okay, that's about also C3, C4.
There too.
Okay, whole lot of stuff on
And
this
there.
left side. Okay, lots of stuff.
And there.
I just realized your name is on your necklace. Now I'm never gonna get it wrong. Yeah. Okay.
Oh. I'm feeling that right here.
You feel that into the shoulder even, huh? Damn.
Ah, yeah, right there. That's real tender.
Are you okay? Are you able to
fine.
tolerate? Okay,
Yeah.
good. 'Cause
I'll
I
tell
do.
you if I need you to stop.
Okay, I do want to try to loosen this up first with some manual muscle work like this before I just go in there and try to open it up, okay? Yeah. So you've had your neck adjusted before then, yeah?
Uh-huh.
Alright, so I don't even need to do my usual surprising trick. for
No.
you. Awesome. Yeah, just relax that head as good as you can. Good. Good.
I could give you a good reaction if you want for your TikTok.
That's okay, I don't need one. We go for authenticity on this channel. I'm not in for the fakers. FYI, you guys, every video I do on here is only stitched together. There's no editing around like patient reactions or sounds or shit, because I hate that. That's a pet peeve of mine, so. Real videos, real patients, real chiro. Ah, there's a new slogan. All right. Thank you for being here. You just witnessed magic. Oh my god. Alright, for me. Good. Drop. Very good. You okay? Sorry, I pulled your hair there a little bit, didn't I? Good job.
Thanks.
So when we're dealing with this anterior pelvic tilt, we have to try to loosen up everything in the paraspinals as well as the quads. We'll do the quads later. She's also dealing with that upper back tightness in the neck, so it makes sense to just kind of do everything back here first. So let's get into it. Again, with the anterior pelvic tilt, we have hypertonicity of both the hypertonicity of the anterior hip flexors. Okay, so that's going to be the quadriceps on both sides. We're going to be scraping those today. We won't be able to scrape the psoas. It's too deep of a muscle, but we will have a method to do some MRT to that later, for which we'll try very hard to not make her cry. But let's get into it. I wish y'all could see her face right now. It's already a little bit priceless.
It's fine.
Now, Kat, if at any point in time this is too much for you to bear, I'm going to ask that you suck it up.
Oh my god.
This is just the warm-up tool.
I know.
Yeah, okay. Now, this would normally not be as tight if anterior pelvic tilt, or lower cross syndrome, which is what it's also anecdotally referred to, or medically referred to rather, was treated in earlier stages. But given that we're dealing with this 10 years out, we can expect a little bit of table riding. You're doing great, Kat.
Mm-hmm.
Positive affirmations, right? There you go. You're almost getting used to it. Just get you to open up a little bit. There we go. Just get you to stop hiding. Yep, there we go. So tough. Breathe. I don't know why I have to remind all my patients to breathe. You're good, you're good.
I know. Roll this down. And then this one, do you want to roll this one up for me, please? Thank you. Now you're lucky we're filming this and my phone has limited battery life. It means that we're actually going to go for not as long on the legs as we normally would. Alright, there you go. She seems so thankful for that. I can see the smile on her face right now. Oh my god, okay. Better, worse, or the same as the left? The same.
The same, awesome. Oh, worse down there. Okay.
Ow. Ow, oh my god.
That's bad down there.
I need
Okay.
to stop for like
Okay, let's
30
take a second.
seconds.
So
That's a
that
lot.
right there,
Ow.
you're okay.
Yeah, I'm good. I'm
That-
just like,
that right
that's
there
fucked.
is the VMO, or the vastus medialis obliquus. Do you have any knee pain on this side at all? No? Okay, interesting. Because usually when he's super... I can't even put pressure on that right now. Usually when they're super tender, we do get some knee pain associated with that. Okay?
Yeah.
Let's take 30 seconds.
Oh
right?
my
You
God.
just breathe.
I've never felt that before.
You're surprised right now, eh?
I am.
Her face is one of genuine shock. I need a second camera for like a face cam that I can put like right here.
The GoPro reaction?
That's what I'm gonna do. I'm not tossing this phone like a new one. I'm just gonna get a second. Wow, okay, big twitches. So, alright. When you're ready, we're gonna start this back up. You ready? You're not sure. She doesn't know she's ready right now.
I don't know, I'll shake. Damn, because I can even feel it right now. Like when you're not even touching it. Yeah. Ah. It goes all the way.
All the way up.
It stopped now.
Okay, so how's when we're more into the adductors?
There.
Okay, very
And
much
down.
and down.
Ah.
Yeah. We are tracing the vastus medialis with this, okay, which is one of the 4 quadricep muscles. We are very so FYI, this is not a normal reaction. Okay, like this is not present in people who don't have this kind of long-standing condition. It's okay. We can handle it. You're okay. All right. Her face is going from shock to concern. So I need to reassure. Reassurance is important here. Okay. I've seen this before. Okay. So don't worry.
Fuck.
How are you laterally outside here? That's
that's
all
fine.
okay, huh? Warm-up tool's done.
Yay.
Can you tell I'm trying to avoid the inside right now?
Mm-hmm.
It's called being considerate, but we will need to get to it. Okay. Let's try the inside.
Okay.
Okay? I'm going to get you to just rotate the hip out. Good. Nope, come right back a little bit. Perfect right there. Okay? So. That wasn't so bad. Hey, she's okay. Look at that. Sensitivity's calmed down. For the most part. Maybe. Really only on that inside, huh? At least we know where we need to work the most. But don't worry, I think we're done the hard parts for today. You're welcome. Okay, clean that off. I'll get you to roll that down yourself there. All good.
We good.
So we just finished using our instrument-assisted soft tissue therapy to the quadriceps muscle group here. That's one of the 2 primary hip flexors, right? The other primary hip flexor being that psoas, which we talked about earlier. So in order to do MRT or myofascial release technique for the psoas, we got to do it like so. So first off, I'm going to get you to bend this knee for me. Bring this foot up and just keep it right there, Kat. Good. Now I'm going to get you to just turn your face that way for me. Thank you so much. All right, so big breath in for me. All the way out for me. And as she breathes out, I'm going to sink my hands down just past that ASIS. Once again, breath in and all the way out. Good. Okay, good. We're there. Oh, got an email. Now I'm going to get you to very slowly from this position, lift this leg up off the table about 5 inches 10 times. Okay, go ahead. Good. 2. Okay. Now I'm usually very bad at counting, but I'm going to try really hard that we cap it at 10 for you today, okay? Eight. 2 more, I think.
That was 7.
That was 7? Oh, look, I'm trying to be nice. 8, 9, and 10. All right, good. So now we're going to go a little bit higher. Again, find that ASIS, creep up higher. No, it's okay, you don't got to move the sweater. We're going to be right here, breath in, all the way out. And again, in, all the way out. All right, go ahead, 10 more. You're tough and you're strong, okay? That's 5.
Mm-hmm.
See, I can count. Good. Okay, now only one more on this side. And full disclosure, this last one is usually the most tender. Okay? So, again, find that SIS. The psoas, again, goes down to connect into the groin region, so right around here on this side, so you guys can see it. We're going to do that on this left side over here, right about, oh, this is going to be great. Okay, we're right about there. So, for this, same concept. Big breath in, all the way out. And one more in, all the way out. 10. I believe in you. There you go. You're okay. She was saying she was going to come back to follow up treatment after this. I'm not so sure after this one.
I am. This is like, oh my god.
She can't even finish the thought.
Oh, that was 10.
That was 10? Okay, what is this like?
I don't really know where I was going.
Her
Like,
mind was just
okay,
going.
oh no, you know when like a bear like scratches a tree?
Yeah.
And like you get the spot that doesn't get got?
That doesn't get got?
Mhm.
Oh, okay, so I'm happy to get the get not got spots.
You got
Get the got not got
you
spots.
got the ungetted spot.
Okay. Okay, awesome. All right. Let's bad news, you have 2 psoases, meaning we have to do it on this side now, okay? All right, so big breath in. All the way out. One more in. All the way out. 10, go ahead. Now you guys can't really see this now because my body's in the way, but she's doing those same leg lifts on this side this time around, okay? Good, I wasn't counting. Eight. 9. One more. 10. Good job. Awesome. Okay. Gonna go up higher. Big breath in. All the way out. And in. All the way out.
You sure you weren't there already?
Yeah, no, I didn't think so. All right, 10, go ahead. Just breathe normally, okay? You're good. Got to get the not getted spots, so. For what it's worth, this hurts my fingers too. Poor me, right? Yeah, that's what I thought. I think that's 7. 8. 9. And one more. Good. All right. Last one. Groin region, breath in. All the way out. Once again, in. All the way out. 10, go ahead. Yeah, that's it right there. Okay. Almost done. 7. Ooh, 8. We just felt a big muscle knot. That's what that was. 9 and 10. Awesome job. Good job. You survived. Are you okay?
Yeah, I'm
Get a
good.
fist bump. There we go. Kat, how did you find all of that?
Besides painful,
Guilty.
lots of release there for sure.
Good.
Definitely in the hip sockets. I felt like yes, like that we got the spot. So
Happy to hear.
that was really great. I feel like I'll probably have a little bit of bruising from the,
Probably.
but that's
yeah.
just because I'm a bruisey person too.
It's also the normal response with that kind of intervention. You can expect some soreness. You can expect some mild bruising. It's all gone through in the consent process there. So, yeah. Regarding the hips, it's interesting because when I did the hip range of motion exam, you actually have full range of motion within your hips, right? And I know we talked about the low back, how you do like a lot of stretching movements that provides you like minimal to not much relief.
Yeah.
With you having your fully available range of motion, but still getting discomforts, it makes me think that you have less of a stiffness issue, but with the exception of the low back and the quads. We know that those need to be loosened up because of the lower cross syndrome, but more specifically with the lower back regarding stability.
Yeah.
Okay, so when we're trying to stabilize a structure, or at least improve I don't like to use the word stabilize because we need to switch between positions of being stable as well as position of being mobile, especially you would understand that as a dancer. What we need to do is be able to increase the load tolerance of the muscles themselves, and that is referred to as core stability, even though the word stability itself kind of carries with it a couple of misconceptions. You mentioned earlier that heavy lifting is pretty much off the table for you. May I ask why that is? And I think I know the answer, but I just want to confirm.
Lower lumbar pain.
Lower lumbar pain. Okay. When I say the words core bracing to you, what does that mean, if
And
anything?
even doing, like, to me, like, tightening my abs and, like, trying to use as much of those muscles that I can. But it's like, and I don't have a lot of strength in my core. I know that.
Now you said tightening your abs. I'm very interested in the word tightening specifically, why you chose that word. When you brace your core, how do you do that? Do you draw in or do you push outward with your core? If you can even recall right now. If you can't, that's okay. I'm just curious as to what your brain is telling you right now.
The clenching.
You clench, right? You clench in.
My stomach.
Okay.
Yeah.
That is a super common misconception amongst everybody who essentially doesn't have an understanding of how core bracing and the Valsalva works, okay? So your core, your abdominals, are supposed to provide the role of the rib cage to your lower back, okay? You don't clench down to stabilize everything. Okay, an example I like to use is like a cell phone tower. The guy wires, are they nice and slacked, or are they really, really taut, pulled tight? They're taut, pulled tight, right? The way that you properly brace your core to decrease shearing forces between your relative vertebrae, between your discs, your muscles, whatever structure is being irritated, is to actually push outward. Pushing outward provides way more stability than drawing inward. And that's something that people don't know. There was some kind of miscommunication somewhere along the line. Take it from the guy who, when he learned how to finally properly brace his core in his undergrad, his bench press, squat, deadlift went way, way up. It's because you are way more stable when you do this. So I'm going to walk you through a proper core bracing tutorial after this. My guess is that your pain is going to be significantly less, okay? As well, what else did I want to talk about here? I can't even remember. I went too much on a tangent. Do you have any questions about that, or any other questions for me at all? Like we talked about a bit. Oh, when I walked you through the diagnosis. Yeah, well, what were your thoughts when I talked you through that on my app over
Yeah.
there? Yeah.
I've been in chiropractic like on and off for about 10 years, and I've never had someone actually explain my diagnosis to me.
Okay.
And
Well, not okay. That's upsetting.
like
but still.
that's what I was gonna say. Is like that for me today is more of a realization of the failure of my past.
I'm sorry.
As opposed, ew, that sounded very like.
It sounds pretty dramatic, but it's also true.
It was quite fun. You know, it's like it's just unfortunate that the time and money that was spent didn't fix the issue or lead me on the right path to do so. So I appreciate that you took the time to explain that to me. Use a diagram, a nice colored line to circle it, making the images connect. So I don't know. I really appreciate the explanation, communication, and ensuring that I understood my
I
diagnosis.
can't emphasize, if you're a practitioner watching this, how important patient education is when they understand what is happening with them. A, we have studies to show that they get better faster. B, there's higher patient compliance rate. C, everybody's just happier afterwards, okay? So in this case, obviously I didn't show you guys this on video, but I took some time between the cuts to like walk her through using my Complete Anatomy app, which is the thing that you guys see all the anatomy diagrams pop in through, exactly how the orientation of the pelvis affects the hip flexors and the hip extensors, etc., etc. But I'm happy we were able to kind of explain at least what my impression is, what's going on. I'd say I'm fairly confident in resolving your issue, even though it's been going on for so long, because you are presenting in a very similar manner to many other of my successful patients. I'm not sure if I have a video of anyone with lower cross syndrome yet, but I'm gonna, if not, I'll show it to you later, okay? Do you have any other questions for me for today?
I don't.
No? Awesome. Well, it was very good meeting you,
so much
Kat.
for
I look forward to
everything. I
working with
appreciate
you.
it.
Don't forget to like, comment, and subscribe.
Thank you, Kat.